with social distancing observed because of the comfort they can really bring to people who are bereaved by this terrible crisis.
Andrew Sellew.
Well, I thank my right honourable friend very much, and I know what a deeply difficult issue this is. And the Church will work with the government on these issues to be able to do what she asks safely. I know that she will be aware that in many of our churches, our cleaning is done by volunteers, some of whom are elderly and may have difficulty, for example, coming in between funerals. But the point she makes is very valid and has absolutely been noted.
Going to substantive question, Andrew Griffiths. Andrew Sellew.
I thank my honourable friend for his interest and concern in our hospital chaplains who've done such amazing work in recent months. And the Church works closely with the College of Healthcare Chaplains to ensure support for our chaplains. Anglican chaplains, while being required to hold a bishop's licence, are actually employees of the trusts they serve and not the Church of England.
Andrew Griffith.
Thank you, Mr. Speaker, and I'd like to thank my honourable friend for his comments. Sadly, I was touched by the virus with the loss of my father, and Father John Diver of St Lawrence's Parish in Sidcup was a source of great comfort to him and my family at a difficult time. So would the Church Commissioner join me in recording our gratitude to hospital chaplains and to the clergy of all faiths?
Andrew Sellew.
Well, I know the whole House would want to extend our deepest condolences to my honourable friend for the very sad loss of his father. And what he says about all chaplains is absolutely right, and the Archbishop of Canterbury has himself been volunteering as a chaplain at St Thomas's Hospital, and I thank him very much for his kind comments, which will be deeply appreciated.
Now, the final question from Tim Furran. Andrew Sellew, substantive.
Mr. Speaker, I'd like to thank very warmly and pay tribute to all the teachers and staff in church schools who are providing teaching and care for children at this difficult time. They've moved rapidly to provide online lessons and resources and are looking after the children of key workers, overseeing the distribution of free school meal vouchers. And the Church is also delighted to have partnered with the Oak National Academy to provide assemblies and weekly collective worship.
We go up to Cumbria with Tim Furran. Tim Furran.
Thank you, Mr. Speaker. Well, here in Cumbria, in the South Lakes, head teachers of church schools, in fact all schools, do want to return on the 1st of June. But of course, they see protecting the safety of their school community as their first primary responsibility. So will he make strong representations to the Department for Education, supporting those schools that decide to stay closed for the time being for safety reasons, especially given new government guidance against schools using flexible approaches for returning pupils?
Well, I thank the Right Honourable Gentleman for his question, and in addition to being Second Church Estates Commissioner, I am a governor myself of a church school and actually attended a governor's meeting by Zoom earlier this morning, Mr. Speaker, looking at exactly these issues. So I hear what the Honourable Gentleman says. I will make sure that his comments are fed in, and I know the Department for Education is taking these issues very seriously and will proceed cautiously as we would all expect them to do so.
Thank you. Before the first urgent question, I have a short statement to make. The government has called for Parliament to set an example on how business can continue in this new normal. The government has also set an example itself. It is unacceptable that the business of answering written questions in a timely and substantive way has not continued. The government simply must do better. The departments that do not improve soon can expect to be called to an urgent question on this matter. We now come to the urgent question to the Secretary of State for Health and Social Care. I will call Secretary Matt Hancock to answer the urgent question from Liz Kendall as on the order paper. The Secretary of State should not speak for more than 3 minutes. Secretary of State.
Thank you, Mr. Speaker. One of the first things we knew about coronavirus as it began its dismal spread across the world is that it reserves its greatest impact for those who are physically weakest, and especially the old. In the UK, 89% of all deaths have been those aged above 65. And from the start, we've worked hard to protect those in social care. In early March, we put £3.2 billion into social care, half through the NHS and half through local authorities. And we've repeatedly set out and strengthened guidance for infection control and support. Now, for anyone who has a loved one living in a care home, and all those residents and staff, I understand what a worrying time this has been. And I'm glad we've been able to protect the majority of homes, and we'll keep working to strengthen the protective ring that we've cast around all our care homes. As I said in the House yesterday, last week we set out a further 600 million to strengthen infection control, and this comes on top of a substantial programme of support. Testing, from the start, we have tested symptomatic residents of care homes, even when testing capacity was much lower, and this has always been a top priority. We're now testing all care home residents and staff in England, both those with symptoms and those without. This is being done according to clinical advice, starting with the most vulnerable and extending to working age residents too. Second, we've strengthened the NHS support available to social care. We're putting in place a named clinical lead for every care home in England and brought NHS infection control expertise to the sector. Third, we're making sure local authorities play their part. Councils are conducting daily reviews of the situation on the ground in local care homes, and so every care home gets the support they need every day. Fourth, we're supporting care homes with getting the PPE they need. And fifth, we've increased the social care workforce during this crisis and provided more support. Together, Mr. Speaker, this is an unprecedented level of support for the social care system, and I want to thank colleagues across social care for their hard work. We've also broken down some of the long-standing barriers, including between health and social care. And we've learnt the importance of making sure that money for social care is ring-fenced specifically for social care, as the £600 million agreed last Friday has been. On top of this, we're requiring much better data from social care, because partial data has bedeviled the management of social care for many years and made policy making more difficult. Regular information returns are required in return for this latest funding, and we are looking to change the regulations to require data returns from every care provider so we can better prepare and support social care. Mr. Speaker, our elderly care homes provide for people towards the end of their life. They do an amazing job, and they deserve the praise that they've received from the public during this crisis. Residents are looked after when they need care the most. Their hands are held, their brows are mopped, and they are made comfortable. As a collective result of our efforts, especially of care colleagues across the country, 62% of care homes have had no reported cases of coronavirus. And today's figures, released by the Office for National Statistics, show that the number of deaths in care homes has fallen significantly, down by a third in just the last week, from 2,423 to 1,666. This morning's statistics confirm that 27% of coronavirus deaths in England have taken place in care homes, which compares to a European average of around half. But whatever the figures say, we will not rest from doing whatever is humanly possible to protect our care homes from this appalling virus, to make sure residents and care colleagues have the safety and security they deserve.
In welcoming the Honourable Lady to the front bench, I now call Liz Kendall, who is asked to speak for no more than 2 minutes. Liz Kendall.
Mr. Speaker, over 23,000 more people have died in care homes in the first 4 months of this year compared to last. This virus is the biggest health challenge of our lives, but ministers have been too slow to tackle the problem in care homes. Social care has not had the same priority as the NHS, and these services have not been treated as inextricably linked. Can the Health Secretary explain why guidance saying care homes were very unlikely to be infected wasn't withdrawn until March the 12th, when the Chief Medical Officer warned about community transmission and the risk to the elderly on March the 4th? NHS England rightly asked hospitals to free up at least 30,000 beds to cope with the virus. But can he explain why there was no requirement to test those being discharged to care homes, the very group most at risk, until April the 15th? Care providers had serious problems getting PPE as their normal supply was requisitioned by the NHS, when both are equally important. Why did that happen? It took until mid-April for the government to produce a social care plan, until the end of April to say all residents and staff should be tested, and until the 11th of May to set a deadline for achieving this. And that deadline still isn't until the 6th of June. Can the Health Secretary explain how he squares all this with his claim the government has thrown a protective cloak around care homes right from the start? Despite all the warnings, care homes in my constituency told me over the weekend they can't access the government's new online testing portal, tests aren't being picked up, and it's often weeks until they get results back. When will this be sorted out? Finally, the government has said the NHS will get whatever resources it takes to deal with this virus. Will the Minister now make the same commitment to social care and guarantee no provider will collapse because of this virus? No one denies how difficult this is. But instead of denying problems and delays, ministers should learn from their mistakes so they put the right measures in place in future and keep all elderly and disabled people safe.
Secretary of State.
Well, thank you very much, Mr. Speaker, and I welcome the Honourable Lady to her post and for her first question in this new role. And I know that she enjoys a good working relationship with the Minister for Care, and I know that the cross-party working during this crisis has gone on throughout, and I thank her for that and for the approach that she's taking. She's right and perfectly reasonable to ask questions about how we can further improve the support that we are giving to the care sector. As I have said from this dispatch box before and before her appointment, we have made social care a priority from the start. The first guidance went out to social care in February. She refers to the March the 13th guidance. That was only a matter of days immediately after the risk to the public was raised on medical advice. And the guidance that was in place until then, as she probably knows, explicitly stated that guidance was in place whilst community transmission was low, and said it would be updated as soon as community transmission went broader, and that's exactly what we did. More importantly, she raises the question of discharges, and I understand the questions that have been asked about discharges into care. Now, it's important to remember that hospital can be a dangerous place for people, as well as saving lives. It also can carry risks, and does. And so it is appropriate and a clinical decision, and appropriate in many cases, for people to be discharged from hospital and safer for them to go to a care home. What's important is that infection control procedures are in place in that care home, and those infection control procedures were put in place at the start of this crisis and have been strengthened, exactly as she says, as we've learned more and more about the virus all the way along. And as the clinical understanding of coronavirus has strengthened, so too we've updated and strengthened our guidance. She asked about PPE, which, as she knows, as every member of the House knows, has been an enormous global challenge with the global shortage of PPE and the need to get PPE distribution out to tens of thousands of settings. The guidance that we've put out again, which is guided by the clinical expertise, states the level of PPE that's required, and we're now delivering against those standards. And we have processes in place so that all care homes that have shortages, and the numbers are coming down, I'm very glad to say, can get in contact with their LRF and make sure that they can get that PPE. Those processes are in place. It has been a huge challenge. It was called the biggest logistical exercise of the last 40 years by the head of the army, and I think he was right. And she asked about resources. Of course, if there are more resources needed, we are open to those discussions. The fact that we've put through £600 million more that will go directly to social care, that will not be able to be held by councils, but rather go directly into social care, I think that is right. But we've also learnt some really big things about social care, confirming some of the things many of us thought before. For instance, that it is true that we need to have a more coordinated policy, and we need to have more coordinated coordinated policy between health and social care. And these social care reforms, which are long overdue and have not been put in place by governments of all colours, absolutely must be.
We now go over to Sir Oliver Hill. Sir Oliver.
Well, clearly tackling this virus in care homes is a very difficult thing, but the Chief Executive of Hertfordshire Care Providers Association is on the record as saying that care providers in the county feel well supported during the pandemic. Does the Secretary of State agree with me that what is required to achieve this, as in Hertfordshire, is a very close working relationship, a partnership between care homes, the councils, the CQC, and of course the clinical commissioning groups? It's a partnership that's needed.
State.
Mr. Speaker, I entirely agree. I think we've seen much better partnership working in most parts of the country during this crisis. And the partnership between local authorities with their statutory responsibilities and the NHS with its statutory responsibilities, and as he mentions, all parts of the NHS, CCGs, trusts, and the integrated care systems are very important. They've worked much better over the last few months than they had done hitherto, and we need to make sure that coming together in a very difficult circumstance, which has broken down boundaries, that coming together continues, and I look forward to working with him and others in making sure that the boundaries that exist between social care can be brought to the ground.
I will now call Dr. Philippa Whitford, who is asked to speak for no more than 1 minute. Dr. Philippa Whitford.
Thank you very much, Mr. Speaker. The London School of Economics reported there were over 23,000 excess deaths in care homes in England and Wales, but only 12,000 were put down as due to COVID. How does the Secretary of State explain the other 10,000? Testing of care home staff is critical to reduce spread, but how will he improve the return of results to local GPs and public health teams? Concerns have been raised that a quarter of tests are false negatives, which could send staff with the virus back into care homes and hospitals. It's a difficult sample to take, so is there any comparison being done between self-administered tests and those carried out by healthcare staff? And finally, where is the green paper that was promised in 2017?
Thank you very much, Mr. Speaker. On the point about tests, absolutely work was done and carried out to assess the difference in efficacy between professionally administered and home-administered, self-administered tests, and found that the efficacy was very similar and not significantly different. And that's why across England and Scotland and the whole UK we use home tests. That's an important part of our testing regime. She asks about the difference, the increase in, sadly, the increased number of deaths that there have been in care homes. She's absolutely right that there's been an increase, and we analyse the causes of all of the different factors that may have had an impact, and this is something that our clinical advisors are looking at. The same is true in Scotland, I think, and I'm sure that the Scottish medical advisors are looking into the same. And when it comes to a green paper, at the moment we're working on crisis response, and I think that's the appropriate thing to do.
We now go to Andrew Jones. Andrew Jones.
Thank you, Mr. Speaker. In Harrogate and Knaresborough and across North Yorkshire, the County Council has established a step-down facility for patients being discharged from hospital, using care homes with segregated space, and indeed in Boroughbridge an entire care home, effectively as forms of quarantine facility. This is in addition to the testing and protective arrangements, not a replacement, and I view this as a welcome and valuable addition to the tools available to keeping some of the most vulnerable people in our community safe. Would my right honourable friend agree, and can this facility, this idea, be replicated further across the country?
Yes, I pay tribute to those who are working across Harrogate to improve services in exactly the way that the honourable member, my honourable friend, describes. He's quite right to, and I'd love to look into more details.
Sarah Owen. We go to Sarah Owen.
Thank you, Mr. Speaker. The Health and Social Care Select Committee just heard evidence that there has been not one single care home death in Hong Kong or South Korea despite their proximity to China and shorter time to prepare for this crisis. In comparison, the UK has now tragically seen over 10,000 deaths of loved ones in care homes. How can government describe this as a success? And isn't it time now to learn from other countries who have genuinely put a protective ring around their care homes?
State.
Well, yes, absolutely. It's important to learn from everywhere around the world. And this epidemic has had a different shape in different parts of the world, and as she knows, a very significant impact throughout Europe.
We go to Andrew Mitchell. Andrew Mitchell.
Thank you, Mr. Speaker. It's good to see my right honourable friend bearing up so well under the considerable burdens of his office. Can he reassure me that the PPE supply into the UK and within the UK is now flowing into all care homes in a timely and a comprehensive manner? I'm concerned that those who are running our care homes so well in Sutton Coldfield should have the security of knowing that they can rely on continuous supply.
Yes, I can reassure my right honourable friend and thank him for what he said about the work that we're doing in the department. I can reassure him, firstly, that the supplies of PPE into the country and buying around the world has improved significantly, and we've put huge amounts of effort into improving that. And secondly, that the supplies, once the equipment's in the country, out into the care homes and where it needs to be, is improving all of the time. The number of care homes reporting that they are within 48 hours of a stock out, which is the measure we use, has been falling and is less than half what it was a month ago. But of course, we keep working to get that number down. And then when people a care home is within 2 days of a stock out, we of course immediately work to get them the PPE that they need.
We go to Munira Wilson. Munira Wilson.
Thank you, Mr. Speaker. At the Health Select Committee this morning, Care England said that care staff were suffering a constant cycle of bereavement. With so many deaths in care homes, staff are not only caring for, but they are also comforting those they know well who are dying alone. So will the Secretary of State take steps this week to provide a 24-hour mental health phone-in line to all care staff, as well as fast-track access to professional mental health services, as is the case for the military?
Secretary of State.
I will absolutely look into the proposal that she puts forward.
We now go to Pauline Latham. Pauline Latham.
Thank you, Mr. Speaker. I'd like to say to the Secretary of State that he is doing a phenomenal job. It's a huge crisis and it's a huge thing to mobilise everything that's needed mobilising. And I've spoken to most of my care homes, and most of them are doing very well. But one, Milford Care, is having a problem with getting test kits. 6 people in the home have died recently. They requested test kits on the 12th of May through the government portal, but were told there was a very limited supply. They may get them on Wednesday this week, if they're lucky, but not. If not, they'll have to re-register for them. Staff and residents may be infected, but they aren't aware, and they've had somebody else who was tested and 7 days later was told they were positive, even though they had no symptoms. So clearly the virus is spreading. What can my right honourable friend suggest that they do?
Secretary of State.
Well, I think the best thing they could do is raise it with their very effective local MP, who can bring it to my attention, and that's exactly what they've done. I will get right onto it straight after this session in the House of Commons. We have the testing capability. Of course, making sure you get exactly the right test to exactly the right place in the right care home at the right time is itself a huge logistical challenge, but I'll look into this immediately.
We go to Vicky Foxcroft. Vicky Foxcroft.
Thank you, Mr. Speaker. CQC data revealed a 175% increase in deaths of people with autism and learning difficulties last month. Yet the new care home testing portal is only available to homes whose residents are aged 65 and over. What is the Minister doing to ensure that all care homes are able to access tests? And will the government conduct a review of why there's been such a sharp increase in deaths among these groups?
Secretary of State.
Thank you, Mr. Speaker. Yes, I did address this point in my opening response to the urgent question, and we will roll out testing to care homes of all ages. And this is an area that I take very seriously indeed. We're looking into the statistics that have been mentioned in the public domain. Some of the statistics are not quite as they first seem, and we'll make sure that we publish accurate and full statistics, because transparency is absolutely vital in this area.
Sarah Britliff withdrawn, so we go to Stephen Flynn. Stephen Flynn.
Thank you, Mr. Speaker. The Resolution Foundation have detailed that 61% of frontline care workers in England are paid less than the real living wage. Now, the Scottish Government introduced a real living wage for carers in 2017. Will the Secretary of State therefore follow their lead and, instead of a badge or a round of applause, finally give frontline care workers in England a real living wage?
Secretary of State.
Well, yes, Mr. Speaker, I'm a massive supporter of the living wage, and of course the increase in the living wage that we've seen since its introduction in 2015 has had a very positive impact on the pay of the lowest paid people in our country, right across the board, including many in care homes. And I think that it's an excellent policy, and I'm delighted that we brought it in.
Dr. Luke Evans. Dr. Luke Evans.
Thank you, Mr. Speaker. The 600 million presented by the Secretary of State for infection control is very, very welcome. In particular, having a named clinician to help support care home staff is really important. And that came out in the Health Select Committee with Professor Lum talking about what happens in Hong Kong. One of the lessons they learned several years ago was to have a named person in a care home, but also do yearly, effectively, virus drills, like a fire drill. Is that something that he'd consider putting in place going forward to help deal with the impact of possible second waves?
Good idea. Secretary of State.
Yes, we're doing a huge amount of work now to ensure that there's protection in the future should there be a further increase, and in particular in advance of winter, in case there is a strong seasonality to this disease. As a clinician himself, my honourable friend understands the importance of these areas, and I will absolutely take the idea that he put forward and run with it.
We go to Barry Gardner. Barry Gardner.
Brent Council were at the epicentre of the initial COVID outbreak, with one of the highest hospital death rates in the country. But back in February, they spent 1.5 million to purchase PPE, which they made available to their care homes. In March, they established a separate care facility to provide 14 days isolation for any patients discharged from hospital back into the care system, whether or not they had tested positive for coronavirus. Now Brent has one of the lowest number of care home deaths in London. I know the Minister will want to congratulate Brent, who actually did put in place a protective ring around their care homes. But what he must answer is, if Brent Council had the good sense and the foresight to get this right, why didn't he?
State.
Well, the honourable gentleman makes a really important point, and it comes to the nub of the challenge around care home policy. And I do want to congratulate Brent, and I think that the work that they did was important. But of course, formally and in the law, responsibility for care homes is for local councils. And some local councils, like Brent and others, have done a magnificent job. However, I also understand that it's a reality of political life and our constitution that I am, as Secretary of State for Health and Social Care, also responsible, and I take that responsibility very seriously. However, when it comes to longer term reform, this does bring a conundrum, because the policy levers that I have as Secretary of State are only through councils who themselves have to then act. And on the funding side, we've seen this challenge because we put in 1.6 billion at the start of this crisis through councils without a ring fence. And there are questions being raised about how much of that has got to the front line. So the 600 million we put it through on Friday, we put a very firm ring fence, so it must be paid in a timely manner through to care providers. So I think this actually raises a question not just for the crisis, but for the longer term. When I am held accountable at this dispatch box for the actions of local authorities, I can give support, but we do not have the direct levers. We haven't even had the direct data flows through to the centre, and we're putting that right too.
Harriet Baldwin.
Thank you, Mr. Speaker. And on behalf of the care homes in Worcestershire, can I thank the Secretary of State for the extra £7 million that will be reaching them in terms of helping them tackle infection control. Can he confirm that that money will also be available to support the domiciliary care workers who pay visits on a regular basis into the homes of individuals who need that care?
Secretary of State.
Yes.
We go to Farrell Clark. Farrell Clark.
Thank you, Mr. Speaker. My constituent, Sonia Kaigan, lost her life to coronavirus. She was a highly skilled and committed care worker, but worked in a low-pay sector caused by the near £8 billion cut to the funding in the past decade. Will he commit to ending the scandal of low pay in the care sector and reverse the decade of cuts to social care budgets in honour of my constituent and others who have died doing their job, so that all care workers are paid a fair wage and have the equipment to do their job safely?
Well, yes, Mr. Speaker, we've put an unprecedented amount of funding in over the crisis into social care. There is the challenge, very important challenge, of ensuring that reaches the front line through local councils. But also, we've increased, through the increase in the living wage, the pay of the lowest paid across society and also in social care, and that's something that I'm proud to have supported.
We go to you, Merriman. You, Merriman.
Thank you, Mr. Speaker. The Secretary of State is doing an extraordinary job in the most challenging of times. He will be aware that we have a testing centre down in Bexhill, which is available to care home workers for testing. But if they follow the government advice and get on the website, they'll be directed further afield to Brighton or Gatwick. Can I ask him to help me to ensure that testing centre is made available to care workers so that they have more protection locally?
Yes, absolutely. My honourable friend has texted me about this last week, and I should have fixed it by now, and then I wouldn't have had the question. It absolutely needs to be sorted. We're working on it. Of course, we rolled out these testing centres at unbelievable pace during April, so I hope he'll forgive me and allow me to take a couple more days to fix the problem.
Bel Ribeiro Abbey. Bel Ribeiro Abbey.
Thank you, Mr. Speaker. The Minister may be aware of comments from Martin Green, the Chief Executive of Care England, to the Health and Social Care Select Committee. He says that we should have been focusing on care from the start of this. What we saw at the start of this was a focus on the NHS. He also criticised the discharge of patients from hospitals into care homes, saying people who either didn't have COVID-19 status or were symptomatic were discharged into care homes, which were full of people with underlying health conditions. Ministers, on the other hand, have said that fewer care home residents were discharged into care homes in March than in previous months this year. Will the Minister commit to publishing these figures and figures of how many people were discharged from hospital with COVID-19 into care homes?
Secretary of State.
I'm very happy to look into that. I also saw that Martin Green said it's become clear that in such a crisis we need further direction from central government. That's what we've tried to put in place, working with colleagues in local authorities, but trying to make sure that we get the very best infection control procedures right across the board.
Going to Flick Drummond. Flick Drummond.
Thank you, Mr. Speaker. Firstly, would the Secretary of State join me in praising the work of Hampshire and the Isle of Wight Local Resilience Forum, which has meant that no care home has been without PPE during this pandemic? And will he also join with me to thank the resilience and hard work of all the care workers in the Mearn Valley? But as the Secretary of State's already mentioned, the coronavirus crisis has highlighted the importance of a joined-up approach between the NHS and the social care sector. And he's also assured me that moving forward, we continue to build a more cohesive structure. But will he also consider appointing a social care commissioner who would lead this work and be the voice of the social care sector?
Secretary of State.
Yes, I pay tribute. I join the Honourable Lady in paying tribute to Hampshire, and yes, I'd be very interested in talking to her more about her idea that she mentioned.
We now go to Emma Hardy. Emma Hardy.
Thank you, Mr. Speaker. A resident contacted me whose mum is classified as clinically extremely vulnerable and is in a care home. The care home have interpreted the government's guidance to mean that her mum must be kept in solitary confinement for 3 months for her own protection. In 2011, the United Nations concluded that solitary confinement beyond 15 days constituted cruel and inhumane punishment. The resident is heartbroken. Her mum is deteriorating and has no quality of life. We believe the care home has the best of intentions, but please, can the Secretary of State urgently give clear and unequivocal advice on exactly how care homes should treat residents listed as needing shielding?
State. The Honourable Lady is right to raise a heartrending case, and I'm very happy to look into the specifics, and if she'll write to me with the details. Of course, the shielding programme is there for the protection of the shielded. And so if somebody who is being shielded would prefer to do things differently, so long as it's within the broader social distancing guidelines, then that is not clinically recommended, but of course we understand why that might be the case. And particularly people coming to the end of their life may want to consider ensuring that they enjoy their last few weeks and months as much as they can, and a proportionate approach is required here, and one that is guided by the individual clinical circumstances of that person. And so I very much hope that the care home can come forward with a proportionate approach. I'm sure, as she says, they have the best intentions at heart, and I'd be very happy to take up that individual case.
Holden.
Thank you, Mr. Speaker. Testing for my constituents in care homes in North West Durham has begun, but can the Secretary of State tell me when all care home staff and residents will be tested? And secondly, from constituents in care homes, it has become apparent that some residents are refusing tests due to a fear of what the results could mean. Can he reassure them that getting tested will not affect their treatment and is the right thing to do in the best health interests of everyone?
State. Yes, absolutely. Being tested is the right thing to do if that's what you are asked to do. It's really important. And we're rolling out this testing both of people with symptoms and of asymptomatic people, testing asymptomatic people, to try to find all of the coronavirus that's in our care homes, to be able to trace it and then to be able to end this epidemic.
We go to Alistair Carmichael. Alistair Carmichael.
Thank you, Mr. Speaker. This being Mental Health Week, can we spend some time considering and reflecting on the mental health impact that tackling the coronavirus pandemic is going to have on those frontline health and social care workers that are charged with tackling it? In particular, would it not be a great example for the good working of our 4 governments if an action plan on mental health could be constructed that would in fact have the support of all 4 governments?
Secretary of State.
Well, the Right Honourable Gentleman is right to raise this. This is Mental Health Awareness Week, and I have at front of mind the mental health impacts, particularly on staff, but across the board of coronavirus. We work very closely through the 4 CMOs of the 4 nations of the UK and between ministers to try to make sure that clinical advice is coordinated. After all, it's based on the science, and I'm very happy to look at the proposals that he taken forward and discuss it with the CMO.
We go to Jane Stevenson. Jane Stevenson. Secretary of State will now move on to Alan Smith. Alan Smith.
Thank you, Mr. Speaker. We welcome the announcement by the UK government of a £60,000 payment for care home workers who sadly lose their lives due to COVID-19. Can the Secretary of State confirm that acceptance of that payment precludes subsequent legal action if that death is thought to be due to negligence, and outline the thinking behind that for us?
Secretary of State.
Thank you. I'll write to the honourable member with the full details.
We now go to birthday boy Sir Christopher Cho. Sir Christopher.
Mr. Speaker, will my right honourable friend pay tribute to the owners and managers of care homes who put the safety of their residents first and refused to admit any of the 15,000 hospital patients who've been exposed to COVID-19 and who the government was forcing to be discharged from hospitals at the end of March?
Secretary of State.
Mr. Speaker, I want to say happy birthday to the honourable gentleman and pass on the best wishes, no doubt, of the whole House. And this is the question he raises is a difficult one, because in many cases the best place for somebody is not in a hospital. Indeed, people can catch diseases in the hospital, and so it really needs to be done on a clinical basis, and that's why we've put in place the testing and the isolation procedures and the infection control of people who are leaving hospital to go into care homes.
James Murray.
Mr. Speaker, at the Health and Social Care Committee on the 5th of May, the Government Chief Scientific Advisor told me we need to get on top of it in care homes. We have been very clear about that. He added, what SAGE does is try to distill the scientific advice into a form that others need to operationalise and take accountability for. Will the Secretary of State commit to publishing all the SAGE advice that his department has received throughout this outbreak about infection control in care homes?
Secretary of State.
We do regularly publish SAGE advice.
We now go back to Jane Stevenson. Jane Stevenson. Right, sorry about that. We now come to the urgent question to the Minister for the Cabinet Office. I will call Michael Gove to answer the urgent question from Rachel Reeves, as on the order paper. The Minister should speak for no more than 3 minutes. I now call Secretary of State Michael Gove.
Thank you very much, Mr. Speaker. I'm grateful for this opportunity to update the House on the progress of our negotiations with the European Union. I've today laid a written ministerial statement before the House which provides a comprehensive update on the third round of our negotiations with the EU on our future relationship. And we've also today made public the UK's draft legal texts. And my right honourable friend, the Secretary of State for International Trade, has also published the new tariff schedule that we will operate at the end of the transition period for those countries with whom we do not have a free trade agreement. Negotiators from the UK and the EU held full and constructive discussions last week via video conference. The talks covered trade in goods and services, fisheries, law enforcement and criminal justice, and other issues, with both sides discussing full legal texts. The discussion underlined that a standard comprehensive free trade agreement, alongside other key agreements on issues such as law enforcement, civil nuclear and aviation, all in line with the political declaration, could be agreed without major difficulties in the time available. There remain, however, some areas where we have significant difference of principle, notably on fisheries, governance arrangements, and the so-called level playing field. The EU, essentially, wants us to obey the rules of their club, even though we're no longer members, and they want the same access to our fishing grounds as they currently enjoy, while restricting our access to their markets. It remains difficult to reach a mutually beneficial agreement while the EU maintains such an ideological approach. But we believe that agreement is possible if flexibility is shown, and the agreements that we seek are, of course, built on the precedent